Greetings to Dr. Nur Ayuni. We from Group 3 will be presenting on Case Study 1. Scenario is about KD, a 36 years old gay professional man who has been HIV infected for 6 years. He self-discontinued antiretroviral therapy for about 6 months due to depression. Later, KD developed deteriorating symptoms, thus got admitted and confirmed of PJP. PJP is pneumocystis jirovecii pneumonia. It is a fungal infection of the lungs which is caused by the fungus pneumocystis jirovecii. This fungus is common in the environment and rarely causes illness in healthy people. However, it commonly causes lung infection in people with a weakened immune system or immunocompromised like KD who has HIV. The purplish spots over KD indicate Kaposi sarcoma, which is a type of skin cancer that is common to develop in the later stage of HIV due to severely weakened immune system. This skin lesion condition is a sign of AIDS, as when someone with HIV develops Kaposi sarcoma, the diagnosis changes to AIDS. Next, difference between HIV and AIDS. HIV, termed as human immunodeficiency virus, is a virus-caused infection that damages the human immune system, whereas AIDS, termed as acquired immunodeficiency syndrome, is a condition or late stage of HIV infection that results after HIV extensively damages the immune system and the person becomes very susceptible to additional problems like pneumonia, or development of cancer like Kaposi sarcoma. HIV destroys the CD4 immune cells that causes progression to AIDS. When the CD4 cells counts drops below 200, it indicates AIDS. However, not everyone who have HIV will get AIDS, but without treatment with antiretroviral therapy or medications, the infection will progress to AIDS.
Hi, so for my part is how PJP and Kaposi sarcoma related to HIV patient. For Kaposi sarcoma is considered as AIDS-defining illness that caused by herpes virus HHV-8 transmitted through saliva. Gay men that have sexual contact tend to get the virus, and Kaposi sarcoma is most common cancer in HIV patient due to weak immune response. The treatment will decrease Kaposi sarcoma by suppressing the replication of HIV, and the immune system can counter HHV-8 virus. Appearance of purplish spot, non-productive cough, and shortness breath indicate Kaposi sarcoma when it will affect internal organ after it develops in the body. Next is for PJP. It is life-threatening infection for HIV patient. It is AIDS-defining illness and leading AIDS-indicated disease. So PJP is fungal infection of lung caused by pneumocystis jirovecii through airborne transmission. Due to weak immunity, HIV tend to get PJP infection. Due to lower CD4 counts, activated alveolar macrophage cannot eradicate pneumocystis, so it will allow for uncontrolled replication of pneumocystis organism and develop illness. Night sweats, fever, short breath, cough are the symptoms of PJP.
Illness is the factor that influences the development of the PJP and also KS. The reason why he has been asymptomatic for AIDS despite being seropositive is due to the latency period of the virus. During the latency period, HIV patients are asymptomatic. Eventually, the virus ends up destroying many immune cells, including the CD4 T cells, thus declining the amount of CD4 T lymphocytes in the body. As the level of CD4 lymphocyte falls below 200 cells per cubic millimeter, this causes the KD to be susceptible to the infection and also opportunistic diseases. This is when the AIDS develop. Okay, since KD self-discontinued his antiretroviral therapy, this allowed the HIV virus to replicate, thus suppressing the immune system. His body is now prone to infection and allow the development of the PJP and KS. Normally, pneumocystis jirovecii do not cause harm to the healthy people, in which it is normally eliminated by the lymphocyte. Since KD's lymphocyte is insufficient to fight the fungus, this allows the fungus to cause pneumonia. His stressful work and skipping meals habit also brings more damage to the body, thus enhance the development of the PJP and also KS. Chronic stress decreases the amount of immune cells together with its function. This explains that the stressful work environment experienced by KD contributes to the development of the PJP and also KS. Other than that, people living with HIV are also has high risk of malnutrition as a result of increased metabolic requirements. During a viral infection, body metabolic rate is increased in order to produce more immune cells and to replenish the dead cells. Furthermore, viral replication requires high amount of energy. As DW has been skipping meals, his body is greatly deficient of energy, and this would reduce her body's ability to produce more immune cells. Thus, this suppresses the immune system, making KD more prone to the infection. Thus, skipping meals and stressful environment are the factors that lead to the development of the PJP and also KS. As KD is very prone to microorganisms, poor hygiene will bring more damage to his body. Therefore, maintaining good hygiene is crucial to prevent his condition from getting worse. This includes the hygiene during treatment. Other than that, it is also important for the doctor to treat the pneumonia by prescribing antifungal treatment such as the trimethoprim. To prevent PJP from worsening, continuation of antiretroviral therapy is crucial to reduce the virus replication, thus enhancing the immune system. This will not only prevent him from PJP but also other opportunistic infection. Last but not least, taking care of his nutrition is also vital for his health treatment. This is because HIV infection and nutrition is linked to each other in a way that malnutrition causes faster progression of AIDS compared to the well-nourished person, as the body is lack of energy to fight the virus and also other infection.
For question 7, the precautions need to be used when caring for KD are focused to hand hygiene, gloves, and safe injection practices. For hand hygiene, firstly, wash hands with either antimicrobial soap or non-antimicrobial soap and water when hands are visibly dirty, like soiled with dirt or any other materials. Then, the hands need to be decontaminated with an alcohol-based hand rub to prevent any contaminated condition to patients and also other people. Also, do not wear artificial fingernails or extender. For gloves, wear gloves when in contact with potentially infectious materials like blood and bodily fluid. Wear gloves that is appropriate to the task means that wear right type of gloves for the right task. For safe injection practices, use an aseptic technique in which it uses practices and procedures to prevent contamination from pathogens and involves very strict rules to minimize risk of infection. Do not reuse instruments for another patient. Do not recap, bend, prick, or hand manipulate used needles. As for question 8, the focus of the ongoing assessment is to monitor KD's pulse rate, his temperature, as well as his breathing and respiratory assessment. These are required to determine the progression of his condition and whether he needs to proceed with second-line therapy or if there are indirect adverse effects of certain drug happens to him, like when pulse rate increase, it can show that he have complication toward his condition, while increase in temperature can show that he has fever, while breathing and respiratory assessment can show his respiratory status and predetermine whether he has respiratory failure or respiratory illnesses like tuberculosis or asthma or even respiratory complication. All of these are to provide continuous care, early intervention, and also adequate medical care with therapy.
Hello, I will be presenting on major side effect of trimethoprim sulfametazole, which is an antibiotic given to KD. By referring drug.com website, I assume major side effect as common reports by patients that consume the Bactrim itself around the world. I will categorize them into gastrointestinal disturbance such as nausea, diarrhea, and vomiting, allergic reactions like rash and urticaria, metabolic disorder, hyperkalemia, neurological effect such as headache, respiratory discomfort, sore throat, and others. symptoms like fungal overgrowth and unusual bleeding. Next is aspect of KD care can be delegate to the nurse. First, we need to administer first dose of Bactrim because we are then assured that this disease caused by PJP. Next, to care on KD breathing problem, we need to monitor pulse oximeter reading and report if value under 95% and develop a plan of care to improve KD oxygenation status. Also, we need to repositioning KD and having him deep breath every 2 hours. Congratulations, KD is responding well, but he still needs to restart his ART regimen and radiation treatment for Kaposi sarcoma. Also, follow up his care at outpatient clinic. When he got well, in the bracket, because of the treatment, he asked why he has to keep taking the drug. For this case, there are only two things we can provide, which are education and encouragement. We need to strongly advise him to continue his treatment, especially ART, but we still cannot force them to take it if they don't want to.
The 4 additional topics that should be discussed with KD before he goes home includes the effect from stopping of HIV medication. If the patient stops taking HIV drug, the viral load will go up, means that the HIV can damage the immune system and the patient more likely to pass HIV on. Besides, if the patient regularly miss the dose, there is a risk of HIV in the body to become resistant to their medication and the drugs will no longer work to their body. Okay, the second one is taking care of emotional wellness. Emotional health is a very important part of overall health because it can control of our thought, feelings, and behavior and also be able to cope with their life challenges. So the third one is optimize the immune system. It is important to optimize the immune system because immune system will protect us from disease and responsible for down-regulating immune and response against external harmless trigger. And the next one is plan to manage the side effect of medication by listing all the drugs of the patient took and refer to doctor in order to minimize the side effect of medication to their body.
For lab tests to monitor KD is first, complete blood count to measure concentration of RBC, WBC, and platelets. It can reveal infection, anemia, and other illness. Next is blood chemistry test to measure chemicals in blood. It is to detect side effects that caused by HIV medicine. Next is CD4 T cell count. It is as indicator about how well our immune system working. And lastly is HIV viral load to track HIV particles in blood. It is as guide for HIV medication and then repeat the test to track response to the treatment.
So the next question, list at least 5 other opportunistic infections that KD is at risk for developing. So basically, positive HIV patient has weak immune system and has a greatest risk to get infections, include pneumonia, tuberculosis, encephalitis, meningitis, and gastroenteritis. So HIV causes the dysfunction of cell-mediated and humoral immunity. So basically, CD4 T cell will help other cells to achieve their effective function. But for HIV positive, will cause low CD4 counts, which correlate with immunosuppression, and this will cause disruption of B cell differentiation, impaired B cell function, particularly memory cell that are correlated with high risk of infection.
These are the list of references that we used for this case study 1. And that's all from us, Group 3. Thank you.